This is Jeremy with CryoClarity, and in this video, we're going to be going over the nasal sinuses. Now, before we go into the nasal sinuses, we must first understand what some of the namesake implies. So whenever we say sinus, a sinus is a space or cavity within the body, and it doesn't necessarily have to house anything. Like some of the sinuses or paranasal sinuses that we'll be talking about are just air-filled spaces that are lined with mucous membranes that allow them to produce some sort of mucus that we commonly find in this nasal cavity. And so although we're talking about the nasal cavity, we're talking about the association that the nasal cavity has with the paranasal sinuses. So whenever we think about the nasal cavity, some important things to note off the bat is that the nasal cavity, its main perfusion is the sphenopalatine artery, which is a branch off the maxillary artery. Therefore, whenever you have trauma to the nose and it results in a nosebleed, also known as epistaxis, it is usually due primarily to damage of the sphenopalatine artery, which is a branch, again, off the maxillary artery. So looking at this cross section of the nose and the nasal cavity, with the left and right sides being divided by the nasal septum, which is hyaline cartilage, innervated by cranial nerves V1, V2, so cranial nerve V1, V2, the two divisions of the trigeminal nerve that are both sensory only, the ophthalmic division and the maxillary division. So looking at this cross section, we can see three different points. Here we have the superior, middle, and inferior nasal concha. So these are our nasal concha, also known as our turbinates. Nasal turbinates. So a nasal concha is also known as a nasal terminate. And these are structures that we find within the nasal cavity, and they are associated with the paranasal sinuses. And so just as we have three concha, we have three different spaces between the concha, between some of the concha, but specifically below each concha. And so just as we have a superior concha, we have a superior nasal meatus. We also have a middle nasal meatus and inferior nasal meatus. So this is kind of like the space underneath the concha. To give a analogy, we can think of a house. And so if we have this house, and this house has a roof, and this house also has gutters, well, the gutters come here, the gutters drain here. And so if we look at this a little bit closer, we can see that this roof sits over where these gutters drain. So the roof can be considered the concha. The gutter, or this opening of the gutter, can be considered the meatus, and the contents coming out of the gutter is going to be considered the sinus drainage. And it's typically that mucus production from the mucous membranes lining the paranasal sinuses. And so the concha is analogous to the roof, the meati are analogous to the gutter, and the content within that gutter is analogous to the content within the sinuses. So looking at this a little bit closer, just as I wrote out up here, the nasal concha or nasal turbinates, I mentioned the nasal meati or meatus for singular. So now we have to talk about the contents within them and what drains where. And so this is a separate concept. We're just going to keep this here for now. And now we're going to talk about the paranasal sinuses. So whenever we think about the paranasal sinuses, there are a few different considerations. We have the ethmoidal, which is divided into the anterior, posterior, and middle ethmoidal sinuses. Singularly, they can also be known as air cells. We have the frontal sinus, and we have the maxillary sinus. And last but not least, we have the sphenoid sinus. And so purple stands for sinus in this case. So boom, 1, 2, 3, 4, 5, 6. There are 6 sinuses. Now, we will have 6 total structures draining in the collective meati, but they won't all be sinuses. There's going to be one exception, and we'll get into that. To start off, the easiest way to start remembering these is that draining at the middle nasal meatus, specifically through the semilunar hiatus, because it's supposed to look like a crescent. So specifically draining through the semilunar hiatus of this middle nasal meatus, we have the acronym AM-FM. So AM-FM, kind of like the radio station, but in regards to sinuses, this mnemonic is going to stand for the anterior and middle ethmoidal sinuses, as well as the frontal and maxillary sinuses. So that's 1, 2, 3, 4 sinuses draining into that middle nasal meatus. So we have 4 sinuses draining here. The next follow-up question to this is, if 2 out of the 3 ethmoidal sinuses drain in the middle nasal meatus, where does that last one drain? This last one is actually going to drain in the superior nasal meatus. So the posterior ethmoidal sinus drains at the superior nasal meatus, whereas the anterior and middle ethmoidal sinuses drain at the middle nasal meatus, and they are specifically associated with the semilunar hiatus. Now, aside from the semilunar hiatus, or a part of the semilunar hiatus, we will also see an opening for the maxillary sinus. That's also known as the maxillary ostium. That's part of the semilunar hiatus, and that's just a distinct feature of the semilunar hiatus that we can see, and that's specifically associated with the maxillary sinus. So all 4 of these sinuses drain through the semilunar hiatus within the middle nasal meatus, which sits inferior to the middle nasal concha. So now we have 5 of our sinuses checked off. That leaves 1. But remember, there's going to be an exception to what drains in these meati. And that exception is going to be associated with the inferior nasal meatus. The structure that's actually going to drain here is the nasolacrimal duct. This structure draining at the inferior nasal meatus is responsible for whenever your nose runs, whenever you cry. And so we have 5 total sinuses draining in these nasal meati, which are all associated with the respective nasal concha or nasal turbinate. Now, the last question then is to clear up with the sphenoid sinus drains. The sphenoid sinus is going to drain at the sphenoethmoidal recess. This wraps up the nasal sinuses. These are different than venous sinuses. Remember that a sinus just means a space, whereas venous sinus implies it's filled with venous blood, and nasal or paranasal sinuses imply that they are related to the nasal cavity.